So the second species we need to describe is Clostridium tetani. It is the causative agent of disease known as a tetanus. Bacteria have terminal location of spores. They are oval in shape, and actually spore-containing vegetative form have unique appearance, which is usually described as a lollipop or drumstick appearance. As you can see on the picture on the slide, shape is quite unique, easy to identify bacteria even by gram stain. Bacteria as well have toxin production as the main virulent factor. Two toxins are identified. It is tetanus, which cause lysis of blood cells in animals and humans, and tetanus spasmin, the main toxin. It is a neurotoxin, and actually till nowadays it is the second strongest organic toxin on our planet after botulinum toxin, which will be discussed in the next part of the lecture. And some 0.3 milligrams is enough to kill strong adult men. It's really small dose. It's almost invisible in diluted state, and of course, toxin is very potent and very dangerous for humans. As a biological toxin, the toxin consists of two subunits, B and A. Toxin can identify and bind neuron cells, penetrate inside neuron, and A subunit, active subunit, is responsible for blockage of GABA system, and actually toxin can suppress that stop part of the brains. As you remember from some physiology, we have two main, if it's fine to say, all neural system can be divided into two major parts. It is the start part and the stop part. The start part is responsible for activation, for initiation of the signal, and stop part is responsible for inhibition of the signal. So tetanus spasmin can inhibit that stop part, and actually any activity of the muscle cannot be stopped. If subjects start to move with some muscle, that muscle will contract continuously, unstoppable, and that activation cannot be suppressed or inhibited. So similar to other toxins produced by Clostridium, identification is usually done by neutralization on animals or by biological method. So tetanus is one of the old diseases. It is known for decades, even centuries, and the main manifestation of the disease is massive tonic muscular spasms, initially in affected area, but with further generalization of the process, and actually the whole body can be affected with massive spasms, and people cannot move with any muscle. So similar to other clostridial diseases, infection is initially transmitted by animals, large herbivorous animals, and spores are present in soil and environmental objects, in air, almost everywhere. So group of risk is usually small kids, which are always messing in the streets. They cannot wear shoes or boots. They can step on something. They always curious. They trying to look for some things everywhere. And some professions such as a farmers or constructory workers who have high risk of punching wood with some instruments, nails, during their job. And of course, again, it is a type of the war wound when gunshots and some injuries with contaminated with soil are common thing. So incubation period in general is about 1 or 2 weeks, but as far as I remember, the most prolonged case of incubation period lasts up to 2 years, and usually incubation period depends on location of the wound. If it is lower part of the body, some leg, then incubation period can be a little longer. If it is a wound closer to the head, then incubation period can be shorter. So similar to gas gangrene, disease will start with early and local symptoms when wound will be the main reason of suffering, dull pain will appear, and even if wound can be already healed with some few months after the wound is absent, it is already healed, but affected person will feel like it is still here. He or she will say that I still feeling that wound, it is here, it is painful, and I feeling like it's not healed. And if it is a wound near neck or near head, then lockjaw, that symptom is manifested by inability to open the mouth. People can move with the tongue. They're trying to say something. They're trying to communicate, but muscles of face are not working, and people cannot open the mouth. So after early symptom, main phase will occur. Usually it lasts again up to 2 weeks, and it will manifest with descendant convulsions of muscles, means they will start from in the face and the head and goes down. So usually first type of muscles affected is the mimic muscles. People will have a unique appearance of a mouth like a sardonic grin or sardonic smile. In further slide, I will show you that photo. Then neck will be affected. People cannot move. Head will have unique position. It is always hindered. Then upper extremities, spinal muscles, lower extremities will be affected. And actually the main reason of little outcomes of that disease is blockage of diaphragm, and people will have respiratory failure, apnea, and they can die because of mainly that reason. Of course, nowadays it is a little easier because we have available methods of artificial lung ventilation. We can support those people for required time period. But previous years, when it was not so good medical health, those people mainly died because of acute respiratory failure. Disease as well can manifest with dysfunction of kidneys and urinary tract, but it's not so important in that case. So usually convalescence, complete convalescence will be observed in up to 2 months. Disease will descend in symptomatics. Slowly, tonus of muscles will come back to normal. Some slight motility will appear. Then complete release of muscle spasms will be observed. And little outcome, maximum described little outcome, is up to 25%. Again, mainly because of some organs failure. But in the case of timely medical help, that rate, of course, can be decreased significantly. Few photos or pictures of the tetanus. In the upper part, you can see that position of men who suffered from generalized muscle spasms. The strongest muscles will prevail, and usually those people lying in the bed by touching with the neck and only with the legs, and the whole body is an arch is above the bed or above the surface where those people are placed. Of course, they are lying in that position, they cannot move any muscle, and they always kind of fixed. They cannot eat properly. It's extremely difficult to breathe, and without medical help, mortality rate can be high. So sardonic grin or sardonic smile, when people always kept the mouth open, teeth are closed, but mouth and lips are open. Those people, of course, it's kind of looking like they're smiling on you, but they cannot move just with the muscles. They, of course, unable to drink and eat, but they're trying to communicate until it is possible. And we have that infant tetanus there when birth delivery is performed in not correct conditions, in not in aseptic conditions. And umbilical wound can be infected with spores of Clostridium tetani, and later those kids will suffer from similar disease, but and then it will manifest much faster. Similar position of muscles. You see, as you can see, doctor keeping the kid just by the head and legs, and kid is still fixed in the air. Of course, it's extremely dangerous in those group of patients because systems are not mature, and of course, immunity is not very strong. And in kids group, mortality rate can be much higher. So, how to prevent the disease? Of course, again, it is a type of the wound infection, and the main non-specific measure is proper surgical management of the wounds. Any punctured or closed wound should be properly cleaned with surgical instruments, washed with antiseptic solutions. Access of oxygen should be provided for the wound, and we have a specific measures of prevention. And nowadays, it is the main type of prophylaxis. We have antitetanus immunoglobulin. It can be human immunoglobulin obtained by hyperimmunization of people. It is a concentrated solution of gamma globulins, and it have antitoxic effect, can be given for people who are already injured and have some symptomatics, or as prevention. It can be infiltrated around the wound. Of course, bacteria which is living in the wound and secreting the toxin should be eradicated as well, and the same antibiotics, but usually in metronidazole plus penicillin combination is sufficient. Symptomatic therapy such as antispasmatic, some painkillers should be provided. Of course, monitoring of vital functions should be performed on those people. If it is required, then oxygenation or some oxygen therapy, artificial lung ventilation, or other types of oxygen masks should be provided. Proper nutrition, proper feeding, and proper position in bed to prevent aspiration of intestinal or stomach containing. All those things should be, of course, properly done for those patients. We have horse serum, which is shown. I like those some ancient photos. You see that this anti-tetanus serum. It is again one of the most old diseases, and of course, a lot of different attempts to give proper medical help are described. And you see those anti-tetanus serum in different types of vials, sealed like an ampoule or sealed with some wax. And as far as animals are acting as the source of infection, then proper treatment of ill animals and immunization of animals who are domestic animals or some farm animals who are kept near the people should be provided to prevent transmission of the disease to human. So we have active immunization as the main measure of prevention of the disease. Schedule of vaccination is different in different countries. In Russia, we have slightly different regimen, but in India, we have the TT, tetanus toxoid, as the monocomponent vaccine. It is indicated in pregnant women, and actually it is one of the reasons to decrease mortality rate in newborn kids and in women as well, because antitoxic antibodies can be delivered to newborn kid as well, and because of high rate of some illegal abortions or birth delivery in non-medical facilities in some communities in India, that indication is very when medical help is not available, or people maybe would refuse to perform birth delivery in hospitals. Of course, it is important to prevent and to save both kid and mother, and TT. First dose should be provided in early pregnancies as soon as possible when pregnancy is diagnosed or identified, and in a month after first injection, second dose should be provided, and booster dose, the third dose should be given within 36 weeks of the pregnancy if it is the first pregnancy, and if woman was already vaccinated before, maybe it is second or other pregnancies, then only booster dose should be given if in last 3 years women already received 2 doses of TT. So in India you have pentavalent vaccine. It is a type of modified DTP vaccine, and vaccination schedule is the same, 6, 10 and 14 weeks. In Russia we still have a separate vaccine, DTP vaccine, trivalent vaccine, but schedule of vaccination is the same. And in elder kids we have in both countries DTP vaccine as the only type of vaccine containing tetanus toxoid. It is given in up to 2 years, and in 5 to 6 years of age, 2 booster doses. And in India, 2 additional doses of tetanus toxoid as a monovalent vaccine should be provided in 10 and 16 years for every kid. So again, that measure is the main preventive method to save lives, to save kids and adults, to prevent that serious disease. Because actually, if some symptom of tetanus is already appeared, it can be late to provide medical help because toxin is already absorbed into brains and effect is irreversible. And of course, it's important to provide medical help before contact pre-exposure vaccination, or even if someone was injured, it is extremely important. It is extremely important to go for the doctor as soon as possible to perform surgical cleaning of the wound if required. And of course, every punctured person or some gunshot and other types of the wounds should be provided with tetanus toxoid, even if no symptom is available now, is present now. But don't wait until any symptom will appear, it will be late. Provide active immunization immediately after injury as soon as possible.